Man, they're making these smaller and smaller. We have to try to read. So, okay, at this station, I know it speaks to blood draws and phlebotomy, but our primary focus is going to be on blood cultures. So we'll talk about blood cultures. We'll talk about order of line draw, okay? And then you'll have an opportunity to spin the wheel. And whichever color you stop on, you can draw a question from that color. If you get it right, which everyone has, you'll have an opportunity to just grab whatever piece of candy you'd like out of it. Okay, so in this station, there's two objectives. The first objective is to identify why we collect blood cultures. What is the purpose of collecting a blood culture?
Determine if there's an infection or bacteria present.
Right. So the purpose is to identify if the patient has a foreign microorganism within the bloodstream, so that we can properly treat them. Right. So you're absolutely right. So that's our first objective. Our second objective is to be able to identify the proper collection equipment as well as technique. All right. So before we get started in that, we're going to focus in on just the middle part of this presentation. So research tells us it is critically important for us to make sure that we use proper collection equipment and technique when collecting blood cultures. Why is that so important? It's important because our patients can have adverse outcomes when we don't do them. Adverse outcomes could result in length of stay being increased. It could result in the wrong diagnosis. It also could result in the wrong treatment for our patient, which could be costly for both the health system as well as for our patients. Research also tells us that one of the most common causes of blood culture contamination is improper skin prep. Okay, so improper skin prep could be that we're not cleaning it correctly, we're not allowing the skin to dry, the antiseptic to dry, or as a collector, we go back and touch the skin after we have did our core prep one step and prep the skin. So leading us right into our second objective is to make sure that we do the proper collection equipment and technique. So let's talk about the collection procedure itself. We want to make sure we identify our patient, right? And then we want to make sure we use the appropriate equipment. So here on this side, we'll talk through the steps of what we should have. So we have the core prep one step, which is what we have right here. So this is what you commonly see on the floor. But if your patient has an allergy to the core prep one step, then you want to use the blood culture prep kit. Okay? So it has alcohol and tincture of iodine. It's located there. And then as far as our collection equipment, you're going to have your 10cc syringe, you're going to have your adapter, and you're going to have a sterile needle. Or you can utilize a butterfly needle and a safety adapter. Okay? And then we talked about our both an anaerobic and aerobic, and then we also have the pediatric. Okay? Alright, so let's start from there. So then we have our appropriate supplies. Then we want to apply a tourniquet and select the vein. We're going to scrub the site using our core prep, one step. And we're going to scrub that site for approximately 30 seconds, okay? And allow it to dry. That's important. Because remember, it goes back to us having contaminated samples when we don't go through that process correctly. There's a special note here. Even though it's allowed, the RNs can draw from the line to do your blood culture, the preferred method is to do straight stick. Go ahead and pop the tops on your blood culture bottle. After popping the top, you want to wipe the rubber stopper with an alcohol pad. When you're filling your blood culture bottles, you want to fill for the adult, the minimum is 5, the maximum is 10 milliliters. For your pediatric, the minimum is 1, the maximum is going to be 4. You won't want to overfill or underfill when it comes to your bottles. You also want to make sure that you label at the bedside. You want to make sure that your barcode is not covered. So let's go ahead and look at this now. Discard your sharps, your needles and the sharps. Now, there's other considerations that you want to remember. When you have blood cultures times 2, and you're using the same arm, you want to wait 5 to 10 minutes. 5 to 10 minutes, and you want to use an alternate side on the arm. If you're using the opposite arm, then you don't have to wait. Now we'll take our focus off of blood cultures and just doing your regular blood drops. We want to remember the 4 steps that are very important when it comes to labeling your Vacutainer tubes. You want to make sure that you put your label directly below the cap of the Vacutainer tube. You want to make sure that the contents are visible through the Vacutainer because it's going through an analyzer. It's not an actual person down there reading your Vacutainer tubes. We also want to make sure that the patient's name is at the top of the label on the Vacutainer. And we also want to make sure that our labels are straight. Here we have where you can scan, use your QR code scanner, and you can scan this, and then it'll show you a video of how to go through the steps of collection of blood cultures.